13-year-old Lauren Miner has entered her teenage years healthy, active, and pain-free 2 years after becoming the youngest patient in Canada to undergo a groundbreaking procedure in Edmonton.
Lauren had an underlying condition called hereditary chronic pancreatitis with a rare mutation in her genes called PRSS1, which puts her at risk of two major things. First of all, developing chronic and acute pancreatitis attacks, which she was having on a monthly basis. Secondly, in the longer term, risk of developing diabetes. And thirdly, a 50% chance of developing a cancer in the pancreas over the course of time.
Her improved quality of life is a result of a leading-edge surgical procedure called auto islet cell transplantation, pioneered in the city of Edmonton. The first successful auto islet cell transplant in Canada was performed in Edmonton in 2002. More than 400 islet cell transplants have been performed in Edmonton since 2000, more than any other centre in the world.
So we took Lauren to surgery just over a year ago now, and we took out her pancreas, and we took out the cells from the pancreas that protect her from getting diabetes, the islet cells. And my colleagues, Dr. Tatsuya Kin and Doug O'Gorman from the clinical islet isolation lab, were able to extract a large number of cells from her pancreas, more than enough to put back into Lauren. So we infused those back into Lauren, up into the portal vein, into the liver at the same surgery. And she did very well afterwards, and she's not had any diabetes since then. Her pain is completely controlled, and she's got a great quality of life. She's a straight A student. She's performing at provincial levels in swimming, and she's one of the youngest people I think has ever been done with a child anyway with this particular condition.
Prior to the procedure, Lauren had endured severe chronic pain from attacks of pancreatitis and more than 24 hospital stays in 6 years.
Yeah, it was pretty awful. And I didn't really understand what was happening, right? As a child, I was born with this and I didn't understand anything else. So my 3 or 4 on a pain scale out of 10 was another kid's 10, right? And I just grew for that to become a 0 because that's how I felt every single day.
The current era of islet transplantation in Edmonton started in about 1996 with Dr. Shapiro coming here on a transplant fellowship. Since about 2007, we've seen a dramatic increase in our transplant efficiency, as well as what a good outcome would be. The other thing would be the auto transplantation program. It's quite small in comparison to some other ones, but we've seen some really good stories come out of it, like Lauren's today. Being able to recover that number of islets from a young patient with a small pancreas is really, you don't come across too many stories like that. So the fact that she's doing so well and is insulin free is a huge accomplishment for everybody involved.
Lauren's healthcare experience has inspired her to become a pediatric anesthesiologist so she can someday help other children get relief from pain. She is also an avid swimmer with dreams of someday competing in the Olympics.
It's amazing. I get to swim every day with my team, and I get to spend time with my friends, and it's been 2 years since I've been in the hospital, right? And it used to be, whoa, it's been 8 months since I've been in the hospital, that's crazy. And that's not my life anymore. I get to live it as I choose.
2 or 3 months after the surgery, she sat down and ate like a big plate of meatballs or something, and she said, hey, it hurt. This is awesome. I didn't know that it didn't hurt to eat for other people.
Yeah.
We really felt that the research going on here with Dr. Shapiro's group was where we wanted to look to. And my wife had done a lot of research and said, we can do this in Canada. And Dr. Shapiro's team is world class, and we want to at least hear from him. And you know, we were lucky. We've had great doctors.
We tried so hard to make her life normal, despite what she had going on, and to stay positive. But those everyday things, like not worrying about your child while she's at school, not worrying about her when she's at swim, more than the average person would, going on a family vacation and not mapping out where all the hospitals are in any town that you might visit, is it's amazing.
From Lauren's perspective, you know, although she had to recover from surgery, now she can lead a full and normal life. She doesn't have diabetes, and she does not have the risk of developing pancreas cancer.
I want to go to the Olympics in 2020 in Tokyo.